Welcome YouTube, Facebook, subscribers, viewers of this video. This is Bill Mack here with another edition of The Middleman. Yes, I'm here with another video for you folks, and this is one of that has been a hot topic, the recent released GOP Senate bill, healthcare bill that was the opposed to the Obamacare, as was released, and not everybody was on board with it. 4 conservative senators said they won't vote for the bill as it currently is. There'll need to be changes, and there's a lot of ways that it's going to need to be fixed, or else these ways in which it is presented won't go through. Healthcare will not be passed, and they'll have to be forced to set it aside and go for tax reform, which is one of the big things Trump hit on during his presidential campaign, was that he would try to go and basically repeal Obamacare. But as we've seen the last couple times, they have tried to put a health care bill. The GOP, the conservative side, has rejected it. They need 50 votes to pass it, and there are currently 4 out of the 52 senators said they won't. So right now, just as it is, they don't have enough votes to pass it. So let's get right into it and see the ways that the bill could potentially break down if not all vote for it.
Senate Republican leaders introduced their secret health care bill on June 22nd to a more or less meh reaction from their fellow Republican senators. That's the problem. Senate Republican leaders have 52 members. They need 50 of them to vote for this bill. Otherwise, it doesn't pass. And kind of like a game of Mario Kart, they have a ton of roadblocks to dodge while they're going really quickly. 4 in particular that they really need to watch out for.
Used to love this game.
Number 1, the anti-Obamacare purists. These are conservative senators like Ted Cruz and Rand Paul and Mike Lee who say, if it's not repealing Obamacare, we don't want any part of it. And a couple hours after the bill was released, 4 senators basically said that. They said, as the bill is, we just can't vote for it. It's not what we promised to our constituents.
I don't think there's anybody in America that's more against Obamacare than myself. As a physician, I've seen the ravages of it. I've traveled to 42 states running on repeal of Obamacare.
Roadblock number 2, I call them Medicaid senators. These senators represent states mostly in the Midwest that expanded Medicaid under Obamacare and now are having a really hard time of voting to cut off that Medicaid expansion without a safety net for a.
And that's important because Medicaid, where it was expanded through Obamacare, helps, but also it can hurt as well. As it helps those that really need the Medicaid, but it also opens up for a lot of people to abuse that and get Medicaid that really should not have Medicaid. And this is where a lot of problems are in conflict. It's kind of like a few bad apples spoil a whole bunch, where they're trying to take it away because so many bad apples have abused it that they're trying to take it away. Not that they're trying to take it away from those that need it, just like the disabled and those that are older and whatever circumstances are. It's those that are trying to abuse it. You know, you have so many, it's become overwhelming to try to support when you have so many that are not necessarily that really need it. But the way our Medicaid is, our Medicaid sanctions are tonight, it's not very tight at all. It is in some cases, but not all of them. So these are ones in the West that voted for this Medicaid expansion. If they vote no, they're going to not want to have to go back home and say, you know, we voted against it, but you got it. You got Medicaid and you got help, but now we're going to have to cut it from you. So I don't blame them one bit. It all falls on the states because these senators got elected to do their job for the people, and for the people not to want health care to be cut, or Medicaid in this instance to be cut as well.
A lot of their constituents. In this group, you have Senator Dean Heller, who is one of the most vulnerable senators in 2018 in running for re-election in a state in Nevada that expanded Medicaid. He's going to have a very difficult time if he votes for this bill, going home to tell his constituents, yep, I voted to end your health care that you got just a few years after you got it. Roadblock number 3, I call the wild card. These are state-specific issues that any senator could come up with and say, I have a problem and I can't vote for this bill because of it. It includes cuts.
And that's important to understand, is with healthcare, it's going to be less federal dollars, more going to the states, and less federal dollars means less help assistance from the federal government and more on the states to do their part and it may be some things that are left out of it that are not all pleasing. Now, me, I'm certainly not disagreeing with some things in the bill to cut or not to provide funding for. I'm not against some of them, but there are some things some state governors or state senators may not agree with for their state and say I have a problem with it and I can't vote, and they won't. And that's all it takes is 3 votes out of all these 52 senators, and it won't go through.
Cutting off funding to Planned Parenthood and other nonprofit women's clinics. So there are at least 2 senators who say they want to see funding in the bill.
It's not the only issue in this huge bill, but I certainly think that it's not fair and it is a mistake to defund Planned Parenthood.
It includes funding for opioid addiction, a crisis that's affecting a lot of senators, especially in the Midwest and in New England. Any number of things could crop up. And remember, all it takes is 3 senators to say.
And that's important. Opiate is a big deal these days. And cutting back funding to help to get that worked on and looked at is essential in order to be able to overcome it. When you take money away from trying to study and focus on these particular things that are running rampant in society today, it really says something when you cut funding for that. So let's just hope. And that's some of the key things some of these senators do face, and they don't want that are high with these abuses of this thing, of this drug and the usages of it. So that's another reason why they can say we don't want to vote, and they don't have to vote for it.
I can't vote for this bill to kill it. Roadblock number 4, the numbers. Sometime in the next few days, we're expecting the Nonpartisan Congressional Budget Office to release an estimate of how this bill affects the healthcare market and your health insurance. If those numbers are really, really high in terms of uninsured, it could derail the entire thing. We basically saw that happen this spring with the House bill. This is a really, really big hurdle to overcome because you have to have a nonpartisan report that calculates the effect of this healthcare bill in a way that you can go sell it to your constituents.
And that's important to understand in the situation is the funding of it. If it's going to cut people out and it's going to be higher, and that's why some of the senators also said this is the more spending in this bill is more than Obamacare is. That's what you're trying to avoid. And if there's going to be more spending, there's no sense in voting for this bill to begin with. And that's what they're saying. It's all about the numbers, folks. When it adds up, if it's going to raise premiums higher and cost higher without, and remember, this bill cuts out subsidies. It does leave taking care for pre-existing conditions, which is a good thing. But then another good thing is that it's not requiring everyone to have to get health care. So you're not going to be penalized, which is a good thing. And whatnot, but it is also too is that if you need to have health care insurance, you should be able to afford it, especially with some with the health care place at some particular parts of it. But it's all comes down to the numbers. If it's too high, they're not going to vote for it. It's not going to fly to the American people. So there's just so many different things that could go wrong with this. And if the senators don't get together on the GOP side, they're not going to have enough, and they're not going to be able to agree with what all is happening. So that's what's going on. I hope you've enjoyed the video. Let's see what happens next few days if these senators can get together, if the bill can be revised or maybe something that will help out. But all we want is health care for as many Americans as we possibly can without cutting it and taking away from so many millions that it could be projected to do it. So I hope you've enjoyed this video from the middleman. I'm Bill Mack here. I'll try to give you these political stories, not trying to have an agenda, just to give it to you straight and just give you my opinion. So I hope you, like I said, I hope you subscribe to my video. If you have any comments or have any suggestions, what you think that they should, that's most important to you in this bill, or what they should keep or what they should add, feel free to drop them in the comments below, and I'll definitely take a look at them. So until next time with the middleman, this is Bill Mack here saying, take it easy. Yeah.